اوكي، موضوعنا راح يكون اليوم glomerulonephritis. راح نتكلم اليوم عن definition of glomerulonephritis. It's acute glomerulonephritis is a common disease in children, and it is one of the diseases that are presented commonly with hematuria, which means red color urine, blood in urine. Acute glomerulonephritis in all probabilities results secondary to preceding streptococcal beta-hemolytic type 12 infection of throat or skin. For that reason, most of the patients will be presented with history of upper respiratory tract infection. Acute glomerulonephritis or nephritis is an infective renal disease characterized by sudden onset of hematuria, oliguria, edema, and hypertension. It is immune-mediated inflammatory disease of the capillary loop in the renal glomeruli. The antigen-antibody complex deposition with the glomeruli results in the glomerular injury, which is stated as hematuria, oliguria, edema, and hypertension. This is definition of glomerulonephritis. This diagram shows anatomy of glomeruli. There is endothelium of the glomeruli, afferent and efferent arteriole, and this is cup of the capsular space of the glomeruli, and this is capsule of the glomeruli. Now I will choose one of your colleagues to answer this question. مصطفى.
نعم دكتور.
اوكي مصطفى جاوبنا، اقرأ لنا هذا السؤال وجاوبنا اياه.
Which is true or false? A, one of kidney function is endocrine function. Dr. True.
Let us put rule. If they are say true, we will give explanation, and if we are say false, and also give our colleague explanation why it is true and why it is false. Okay?
نعم دكتور. دكتور هو هذا الاندوكراين فانكشن يعني الهدول بالاكتيفيشن مع الفيتامين دي مثلا.
هذا تعتبر اندوكراين. اوكي.
او يعني الباراثايرويد هرمون هم يشتغل على الكدني.
اكسلنت، باراثايرويد هرمون. اوكي.
نعم دكتور. Glomerulonephritis is common in children with peak age of onset of 1 to 4 years. دكتور هي more common بالpreschool age.
It is true or false?
دكتور خلينا نقول false لأن هي من 6 إلى 7 years أكثر.
Okay. C.
C. One of kidney function is parathyroid hormone balance. دكتور true.
Okay.
more common female يعني دكتور false. هي more common بالميل.
More common in male.
نعم.
Okay. شكرا دكتور علي. دكتور زين.
نعم دكتور. نعم دكتور.
يمك السلايد.
أي دكتور. Which is true or false? A. Antigen-antibody reaction secondary to an infection is main cause of nephrotic syndrome. Dr. False. Antigen-antibody reaction secondary to an infection is main cause of nephritic syndrome.
Excellent. Okay.
Nephrogenic strains of Group B Beta-hemolytic Streptococcal is one of glomerulonephritis causes. Dr. True.
True. Are you sure?
Like 90% sure.
Okay, C.
Normal blood pressure is rare presentation of glomerulonephritis. Doctor, normal blood pressure is rare presentation.
Okay.
Macroscopical hematuria is one of finding in glomerulonephritis. True.
True.
Doctor, normal blood pressure is rare presentation. أتوقع true همين as well.
Okay. Thank you. Now we discuss kidney function. First, it is play important role in hemostasis function as excretion of the water and foreign substances, maintain water balance, maintain electrolytes balance, maintain acid-base balance. All of these are the essential function in the hemostasis. Hemobiotic function as play important role in erythropoietin production, endocrine function as your colleague said. سوري شباب يعني صار انقطاع. هسه اعتقد الصوت واضح لو لا؟
دكتور واضحات صوت وصورة.
اوكي. راح ارجع ارجع هذا السلايد. It is more common in male than female, most common in the preschool and early school. That means it is above 4 years. Above 4 years. When in children under 2 years, account about 90% of the renal disease in childhood. It is varies with the prevalence of the nephrogenic streptococci and likelihood of cross-infection with skin and the throat. The main cause of glomerulonephritis is antigen-antibody reaction secondary to an infection in the body, which is mainly bacterial. Initial infection, usually either upper respiratory tract infection or skin infection. Usually the period is 1 to 3 weeks before onset of the symptom. Most frequent causative agent, it is nephrogenic strain of Group A. Group A. Beta-hemolytic Streptococcal type 12, which is called acute post-streptococcal glomerulonephritis. It is the most common. That is to say, it is Group A beta-hemolytic. هننتبه عليه Group Beta-hemolytic. Most are post-infection and are associated with infection is rather than this type of bacteria or acute post-streptococcal glomerulonephritis is the most common type of causative agent. The diagram shows the genetic inflammation because of body antigen reaction, cause damage to the glomeruli, inflammation, glomerular capillaries, cause mild proteinuria, mild hematuria, accumulation of the cell, cause block to the glomeruli that will lead to decreased glomerular filtration rate that will be brought with of acute renal failure, increased blood pressure, oliguria, edema, hematuria. ختام جميل. ختام.
نعم دكتور.
Okay, دكتورة ختام. Which is a true or false regarding glomerulonephritis and why?
دكتور A edema and glomerulonephritis usually para-orbital. دكتور true.
Periorbital. Periorbital. Okay.
نعم دكتور. دكتور smoky color urine is one finding of glomerulonephritis. دكتور smoky brown color urine.
Is it true or not?
دكتور false. Smoky brown color urine.
Okay.
Dr. C. High specific gravity of urine is one of glomerulonephritis finding. Dr. True. Increased specific gravity.
يعني هم يكونون concentrated urine. Okay.
دكتور. Dr. Microscopic cell examination reveals presence of red cells, white B cells, bust cell, epithelial cell, and dark picture 2.
Excellent. Okay, thank you. Feature of glomerulonephritis syndrome, which is another name or term of glomerulonephritis, is hematuria, which is macroscopical with pink brown color. It is smoky color like Coca-Cola. Oliguria may be overlooked or absent in the mild cases. Edema, which is usually mild, not generalized as nephrotic syndrome, is often just periorbital, associated with weight gain. Hypertension, it is common. Meaning of common, that's not all. More than 75% of the patient will be developed hypertension, which is associated with increased urea and creatinine, which meaning sign of renal damage. Proteinuria is variable, which found in the nephrotic syndrome. Clinical presentation of the patient with glomerulonephritis is first urinary symptom, decreased urine output, bloody or brown colored urine, edema, which is present most patient mild, manifested by periorbital edema, mainly in the morning, may be appear only in the as rapid weight gain. For that reason, daily body weight monitoring of the patient is an essential step in the management. May be generalized or influenced by pressure. This is regarding edema. Hypertension, it is present in the most common of the patient, around 50 to 75%, usually is mild. Rise blood pressure may be sudden, usually appear during first 4 or 5 days of the illness. All these characteristic feature of the hypertension. Patient also may be present with a malaise and headache, which is sign of increased blood pressure. Gastrointestinal disturbance, especially anorexia, vomiting, and abdominal pain, pallor, irritability, lethargy, dysuria, and fever. What are investigations which should be done in patients with suspected glomerulonephritis? History, it is very important step, followed by physical examination. All these will help us to do proper clinical diagnosis. Confirmation of the diagnosis done by urine exam, showing increased specific gravity, smoky, dirty brown color in urine, reduced or oliguria during 24 hours, mild to moderate severe albumin in urine can be detected. Microscopical examination revealed, as your colleague said, red cell, white BC, epithelial, and granular cast, proteinuria 3 to 4 plus. Blood investigation show an increased level of blood urea, creatinine, ESR, and positive ASO titer, and anti-double-strand DNAs. There is decreased level of the hemoglobin, serum complement, and albumin. Serum complement, that means C3 and C4. And there is albumin, decreased albumin amount in the blood or serum. Hyponatremia and hyperkalemia may occur in persistent oliguria, which is one feature of the acute renal damage or renal failure. And throat swab culture, it is positive for Group A Beta-hemolytic Streptococcal bacteria. Chest X-ray, there is pulmonary congestion, which is one presentation of acute renal failure. رامي بهاء.
نعم دكتور.
اوكي دكتور رامي جاوب لنا هاي الأسئلة.
نعم دكتور. So, which is true or false? A. Hypertension occur in all patients with glomerulonephritis. This one is false because it is common, but not all patients. About 70% of patients have hypertension. So, decrease in level of C3, C4 is one feature of glomerulonephritis. هو أكثر شيء الكومبلمنت C3 دكتور يصير هو الجلوميرولونفرايتس وال بعد اثنين دكتور الاخر النفروتك همين حينقص به C3 والSLE فما اعرف ممكن ترو هو بس C4 ما متاكد ان C3 اي.
Okay. Okay.
Both of them. Okay. Both of them ما اعرف اقول دكتور ترو. اليورين culture may show presence of beta-hemolytic streptococcal in some children. هي السواب من الثروت يعني الثروت سواب هي راح تطلع البيتا هيموليتيك streptococcal in some children.
What about this item? It is true or false?
This one is false. So body weight gain is one sign of glomerulonephritis. This one is true, and that's why it is the important thing is to measure weight or to see weight every day. It is important in patients with glomerulonephritis.
Excellent. Okay, thank you.
Thank you.
What about the treatment of glomerulonephritis? Glomerulonephritis with impaired renal function as severe oliguria, decreased urine output, need hospitalization for special attention. That's mean not all patients with glomerulonephritis need admission. Mild oliguria patient with normal blood pressure can be managed at home with outpatient department-based treatment. Treatment is essentially symptomatic. That means when patient develop headache, we will give analgesia and we will give dietary habit to the patient. Monitoring of the patient should be monitored by closely for presence of hematuria, decreased urine output, and sign of volume overload like edema, hypertension, and congestive heart failure, which is early sign of acute renal damage. أسيل. دكتورة أسيل.
Which is true or false? A. Not all patients with the glomerulonephritis need to be treated in hospital. True. Just severe cases. Bed rest should be avoided in patients with the glomerulonephritis. Not be avoided يعني false but in severe acute phase يعني مو الكل بس يعني false. Decreased dietary protein intake is essential to prevent edema. هي مو prevent edema البروتين يعني false يعني to prevent oliguria أو
Dietary protein intake is essential in management of acute renal damage. Okay.
Decreased daily water intake is essential to prevent hypovolemia. هم عندهم hypervolemia مو hypovolemia. يعني false decreased water intake to essential to prevent hypovolemia.
Thank you. Daily record of the general condition, edema, consciousness level, weight, heart rate, respiratory rate, blood pressure, fluid intake, and urine output. It is essential. The kidney function test must be monitoring at regular interval. Best rest. Bed rest, it is rarely indicated except during acute phase when complication of the acute renal damage may be present. Protect of the child from fatigue and contact with other respiratory infection is important. Position. In congestive heart failure patient or hypertension patient, make the patient lie in the proper position to provide good oxygen supplement. Diet. What about diet? Diet should be arranged with the restriction of the protein. It is important, and restriction of the salt and fluid intake. Oliguria and increased blood urea level persist. Carbohydrate containing food to be allowed freely. The diet of the patient needs not restricted routine, especially in pediatric age. It is restriction of the diet in pediatric age. It is difficult. Fluid intake should be allowed in calculation amount. That means total amount of previously day urinary output within 24 hours plus insensible water loss, which is mean water in the skin, sweat, eye dropping. All this should be calculated, and on that base we can calculate urine output. That means if the patient have urine output 75%, 750 cc urine output during 24 hours. احنا راح نعطيه 750 سي سي فلويد مثلا حليب اكل بلس الانسنسبل ووتر لوس اللي هو 400 مول بير متر سكوير 400 مول بير متر سكوير. Daily weight recording, it is important to assay increase or decrease edema. إيمان رشيد رشدي أيمن رشدي.
نعم دكتور.
أوكي أيمن. اقرأ عنا السؤال.
Which is true or false? A. Daily weight is the most useful mean to assess fluid balance. True.
True. Are you sure?
Yes.
Okay.
To assess edema, not fluid balance.
B.
False.
أيمن اقرأ عنا البي بابا.
Rarely children with acute glomerulonephritis develop acute renal failure. True.
True.
C. Administered of antibiotic, preferably penicillin, is needed for 10 to 14 days to eradicate Streptococcus in the throat or skin. Is important step in glomerulonephritis treatment. True.
E.
D. Liver failure may occur due to hypovolemia. هو يصير hypervolemia. False.
False. يصير عندهم liver.
Hi doctor.
Okay, thank you.
Thank you.
Regarding fluid balance, regular measurement of the vital sign, body weight, water intake, and output is essential to monitoring the disease progress and detect complications that may appear at any time during the course of the disease. The most important complication is acute renal damage. Record of the daily weight is the most useful means to assess fluid balance and should be kept for the children treated at home and for those who are hospitalization. That means even the patient treated at home, we will advise the family to do daily body weight by the same person and the same equipment. نفس الشخص ونفس الميزان يستخدمه على مود يصير اختلافات. Sodium and water restriction is useful when the output is significantly decreased. In these children with the water balance should be calculated with the insensible loss with the volume of the urine output 24 hours. Regarding diuretics, are all patients need diuretics? This depends, are limited to the value when the renal failure is not severe. Diuretic therapy, usually Lasix, is helpful if the significant edema and the fluid overload is present. For that reason, it's not routinely indicated to use diuretics in patients with glomerulonephritis. Rarely, children with acute glomerulonephritis develop acute renal failure. That is answer of the previous question. Not all patients with acute glomerulonephritis will develop renal failure, but it is one sign of bad management, or one of complication of management of patients with acute glomerulonephritis. Acute renal failure present with oliguria that is significantly altered with the fluid and electrolyte balance. Fluid restriction is needed if the patient develops acute renal damage when there is urine output below normal level. Regarding hypertension, acute hypertension must be anticipated and identified early. For that reason, blood pressure management every 4 to 6 hours on each day is essential. Significant but not severe hypertension is controlled with loop diuretics as furosemide and other antihypertensives such as calcium channels blocker, beta blocker, and angiotensin converting inhibitor may be needed. Regarding angiotensin converting inhibitor, it is important to use when the serum potassium is normal. Dialysis, hemodialysis, or peritoneal dialysis, it may be required if the patient develops severe and prolonged oliguria or there is anuria with established feature or sign of renal failure. Regarding antibiotic, administration of antibiotic, mainly penicillin, is needed for 7 to 10 days to eradicate streptococcal in the throat or skin. That means even the patient don't have fever or sign of infection, بس احنا شخصنا acute glomerulonephritis, antibiotic should be given to eradicated streptococcal remnant in the throat or skin على مود لا تنفرز another antibody antigen. Antihypertensive, nifedipine or etanolol, and diuretics are used to control hypertension and its complication. Magnesium sulfate may be prescribed in the encephalopathy, hypertension, or edema. Diazepam also may be needed in patients with restless complication, hypertensive encephalopathy, convulsion. Management of congestive heart failure, hypertension, encephalopathy should be treated accordingly. Complication of glomerulonephritis is hypertensive encephalopathy should be suspected in patients with restlessness, convulsion, severe headache, vomiting, or if there is visual disturbance. Cause probably ischemia secondary to vasospasm or hypertension. Maybe take within 2 to 2 days and is caused bad prognostic sign. Congestive heart failure, it is one complication of glomerulonephritis, occur in cardiac failure due to persistent hypertension, hypervolemia, and peripheral vasoconstriction. Patient with dyspnea, tachycardia, liver engorgement should be suspected this patient to have heart failure. Uremia, which is rare, manifested as evidence of acidotic breathing, drowsiness, coma, hypotonia, muscle twitching due to hypocalcemia, and even convulsion. In anemia, it is caused by hypervolemia rather than loss of red blood cell. For that reason, it's called pseudoanemia. When our manage the patient in a proper way, anemia will be disappear. Thank you. Now I'll choose another the same slide and we will ask our colleague subsequently. Elaf.
نعم دكتور.
Okay, دكتورة Elaf.
Which is true or false? A. Edema and glomerulonephritis is usually periorbital. True. It is usually periorbital. Smoky color urine. Smoky color urine is one finding of glomerulonephritis. False. Smoky, dirty, brown color urine.
Okay.
C. High specific gravity of urine is one of glomerulonephritis finding. True. High concentration. D. Microscopic examination reveal presence of red cells, white blood cells, fast cells, epithelial cells, and a granular cast. True.
True. Okay. Thank you, Doctor. Okay, Bara Muhammad, Bara.
نعم دكتور.
Doctora Bara.
Which is true or false? A. Antigen-antibody reaction secondary to infection is main cause of nephrotic syndrome. False is main cause of glomerulonephritis. B.
Okay.
nephrogenic strain of Group B Beta-hemolytic Streptococcal is one of glomerulonephritis cause. False. Group A Beta-hemolytic.
Excellent. Okay.
C. Normal blood pressure is the representation of glomerulonephritis. هو يصير hypertension 50%. فهي true. Normal blood pressure is rare. D.
Okay.
Macroscopical hematuria is one finding in glomerulonephritis. True.
Excellent. Thank you. علا عبد الحسين.
نعم دكتور.
اوكي دكتور علا.
Which is true or false? One of kidney function is endocrine function. True.
True.
Glomerulonephritis is common in children with a peak age of onset of 1 to 4 years. False. Preschool age. One of kidney function is parathyroid hormone balance. True. More common in female than male. False in male.
Okay, thank you. رانيا حسن. رانيا.
نعم دكتور.
اوكي دكتورة رانيا. اوكي.
Which is true or false? A. Hypertension occur in all patients with glomerulonephritis. Dr. True, بس هو more common. B. Decreased level of C3, C4 is one.
Hypertension occur in all patients with glomerulonephritis?
Dr. True.
لا. Not all.
دكتور هو common, not all patient.
اي فهو هنا يقول لك all patient.
Okay, دكتور. B. Decreased level of the C3, C4 is one feature of glomerulonephritis. دكتور هو C3 is decreased. دكتور C4 or دكتور both of them not true.
لا هو أنا دا أقول لك يعني من نقول decreased complement system that means C3 and C4. Okay.
True. Okay, دكتور. Urine culture may show presence of beta-hemolytic streptococcal in some children. Dr. True. Body weight gain is one sign of the glomerulonephritis. True.
دكتور اقري لي السي.
Urine culture may show presence of beta-hemolytic streptococcal in some children. False. Alpha-hemolytic streptococcal.
لا انتبهي على السؤال.
Urine culture.
زميلك جاوبه.
دكتور True.
مو urine culture. throat culture لازم تنتبهين.
اوكي دكتور.
اوكي. فلازم نكون يعني علي محسن كاظم.
نعم دكتور.
اوكي علي اقرأ لنا هاي.
Which is true or false? A. Not all patients with glomerulonephritis need to be treated in hospital. True. Bed rest should be avoided in patients with glomerulonephritis. I can say that is false because acute cases need to have a bed rest. C. Decreased dietary protein intake is essential to prevent edema. دكتور احنا نسوي decrease هو false yes بس نسوي decrease للبروتين على مود to prevent renal damage. بينما في بالجلوميرولونيفرايتس مثل بالنفروتيك سيندروم مثل نخاف انه ساعدنا تشينج بالانكوتيك بريشر اللي عندنا بروتين ولا هواي وكذا. D. Decreased daily water intake is essential to prevent hypokalemia. دكتور احنا نسوي decrease للواتر يعني على مود شنو؟ على مود انه احنا اصلا عندنا fluid overload يعني مو بس على مود الهايبوكاليميا يعني. فنقدر نقول يعني false.
Hypervalidate is false. Okay.
Yeah.
فوزي مدى أعرف أقراها؟
نعم دكتور. ضحى.
ضحى، سوري ضحى. أوكي، دكتورة ضحى. Which is
which
true
is
or false? Okay, you can
daily,
read. Okay.
daily weight is the most useful mean to assess fluid balance. False. To show decrease or increase in edema. False.
That's
Really?
meaning, دكتورة
ضحى.
ضحى. Daily weight is the most useful means to assess fluid balance, which is reflected by edema. It
نعم
is
دكتور.
another way to say it is to assess edema, because the fluid balance may be manifested behind edema. Okay?
نعم دكتور.
Okay.
B. Rarely children with acute glomerulonephritis develop acute renal failure. True.
True.
Rarely. Administration of antibiotic, preferably penicillin, is needed for 7 to 40 days to eradicate streptococcal in the throat or skin is important step in glomerulonephritis treatment. Doctor, false. 7 to 10 days enough to eradicate.
7 to 10. Excellent.
Liver failure. Liver failure may occur due to hypovolemia. False. Hypervolemia. False.
Even liver failure is not non-complication of the acute glomerulonephritis. It is not complication. The most common complication of acute glomerulonephritis is congestive heart failure that occur due to hypervolemia. For that reason, this statement is not true for two reasons. First reason, there is no liver failure, and second reason, there is no hypovolemia. Okay?
نعم دكتور.
Okay, thank you. احنا هسه خلصنا هاي المحاضرة. إذا واحد عنده أي استفسار.
السلام عليكم.
عليكم السلام.
دكتور بس بالنسبة للانسنسبل لوسز يعني كلهم مثلا نمشيهم رفلي 400 مل يعني مثلا يعني وين البريفيوس يورين اوتبوت مال ذا باست 24 اور لو مثلا اكو مثلا في التقسيم
بير متر سكوير دكتور.
يعني مثلا يعني كل مشي مثلا على 400 مل يعني سواء مثلا كان نيونيت او انفانت او يعني تشيلدرن يعني مثلا بالاضافة الى اليورين اوتبوت لو مثلا اكو فد مثلا فد كرايتيريا معينة.
بير متر سكوير معناته اللي وزنه 20 المتر سكوير مالته شقد، واللي وزنه 30 المتر سكوير مالته شقد. اكو اكويشن تطلع المتر سكوير. هاي المتر سكوير تختلف في النيونيت الانفانت عن الادلت.
مش هي مثلا يصير دكتور مثلا يعني النتائج يعني
مثلا واحد الوزن 30 المتر سكوير مالته 1 فتعتبر الووتر انسنسبل ووتر لوس بير داي 400 بينما اللي وزنه 20 المتر سكوير مالته 75 فتضرب ال 400 في 0.65 راح تطلع لك مثلا 250 سيس. فاكو متر سكوير هي ايكويشن يعني موجوده كل بادي ويت والايج الى متر سكوير خاصه به.
تمام.
اوكي
شكرا جزيلا.
اي اسئله اخرى؟
دكتور السلام عليكم. دكتور بالبدايه انت قلت هسه مثلا هو فقد باليورين اوتبوت يعني فقد مثلا 700 على سبيل المثال 700 سي سي مثلا اليوم كله. زين طبعا هو اكيد مو 700 لانه هو اذا اوليجيوريا فلازم اقل 400 بس مثلا خلينا نقول 700 انت قلت يعني غير من هذا احسب له 700 ونص سي سي 500 ليش زودت هذا هو بس 700 مال يورين تبقى عندي ال 400 بالمتر سكوير واضيف لي اياه ليش قلنا 750 هذا اليورين؟
لا انا قلت لك نفرض واحد طلع 750
اوكي اذا هي
بلس الانسنسبل ووتر لوس بلس يعني مثلا اذا تحسب ويا الانسنسبل ووتر لوس تعطي 300 مو تعطي 300 فلويد اي في.
لا تحسب بالمتر سكوير وشوف ايش قد اجمعها.
لا تعطي يشرب ايش قد بهذا اليوم.
حلو.
احنا ما نحكي على الاي في. هو هذا انت مسموح لك تشرب فلويد بالمي بالحليب بالمرقه بالهذا 1000 سي سي. يعني حسبت 750 مال يورين اوتبوت وحسبت 250 انسبنسبل ووتر لوس، انت مسموح لك تشرب 1000 سي سي. يعني مثلا انا اقول الجريكانه مال مي ايش قد 1000، انت مسموح لك تشرب 1000 بهذا اليوم.
شلون ما يقسمها زين دكتور.
طبعا ماكو شيء ريستركتد 900 1100، انت تعطيه رينج. المهم ما مو هو دا يخسر 1000 وانت تعطيه 1500، راح يصير عندك تود.
اكيد زين دكتور. اكو وقت شغلتين. الاولى دكتور المنهل انه بالبيري اوربيتال الاديما قلت انه بس بالمورنينج، وكذلك الاديما ما يبي جنرالايز اقول العفو انفلونسد باي بوستر. يعني نقدر نستفاد من هذا الشيء اذا ما لقيناها انفلونس باي بوستر او الاديما اذا مو بالمورنينج، يعني اكثر شيء البيري اوربيتال تعطينا غير شيء.
لا ذني موست كومن كرايتيريا بس مو دائما. عادة اغلب المرضى يجي لك ايرلي مورنينج، بس اذا واحد صار بيري اوربيتال اديما ات نايت مو معناته هذا نوت جلوميرولونفرايتس. هاي تخليك اكثر تفكر. يعني موست لايكلي مثل ما قلنا شلون افكر بالانكفالوباثي، اذا واحد صار هدك، اذا صار واحد ارتبل، مو معناته كل واحد ارتبل راح يصير انكفالوباثي، بس يخليك.
نعم
اوكي
نعم زين دكتور. والمغنيسيوم هنا هو شو فيزو دايليشن لو اقول العفو يعني فيزو كونستركشن لو شنو يعني؟
لا هذا اوف دايركت
ماشي شكرا دكتور.
دكتور
نعم
دكتور بس عندي سؤال أكثر من MCQ انعاد إنه هو the smoky is one finding of acute glomerulonephritis، وأغلبها إنه قالت false. هو مو finding يعني هو true. إيه يعني مو false.
true. هو يجي smoky يقول لك يعني
وقفة يعني وغير وقفة.
وقفة. هو يجي فأنا قلت لهم سموكي، قلت لهم بس هم أصروا على أنا يعني ما راح أجاوب الأسئلة، لأن أنا أتوقع إنه هسه أكو فرق كبير بين ذاك الأسبوع وهذا الأسبوع. أنتوا قارين وبديتوا تناقشون وتسألون، فيبقى إنه أنا ما أجاوب الأسئلة اللي فيها أخطاء، لأن أتركها لكم أنتوا تجاوبوها.
أوكي شكرا دكتور.
أهلا وسهلا.
السلام عليكم.
عليكم السلام.
دكتور بس بالنسبة للبروتينوريا بالجلوميرولونفرايتس، يعني احنا قلنا مايلد. زين هي شنو المعايير مال المايلد؟ يعني هي هسه هنا البروتينوريا احنا بالسلايدات مال الانفستيجيشن قلنا 3+ to 4+.
لازم تجمع مو كلهم بروتينوريا طبعا، هاي واحد. ولازم تجمع 24 اور. اذا زاد حد عن الموجود بالنفروتيك سندروم اللي احنا راح نعطيه ليفل معين، هذا unlikely to be glomerulonephritis. يعني احنا نجمع 24 اور بروتينوريا. مثلا اذا طلع 2 جرام مو 4 جرام مثلا النفروتيك سندروم 4 جرام خلال 24 اور، نفكر بالنفروتيك اكثر مما نفكر بالجلوميرولونفرايتس. طبعا الديفرنشيتنج between nephrotic and glomerulonephritis is not easy، خاصة إذا اجى atypical nephrotic syndrome. المينيمال تشينجز اللي هو typical nephrotic syndrome اللي هو ما بي hypertension، ما بي macroscopical hematuria، هذا بسيط تميزه، هذا nephrotic syndrome. اوكي المشكلة بالاتيبيكال nephrotic اللي هو Streptococcal nephrotic syndrome، هذا يكون يجي macroscopical hematuria، يجي hypertension، فلازم نجمع كرايتيريا. مثلا تعتمد على الكلتشر مال ثروت السواب، اذا طلع نيجاتيف تمشي ويا النفروتيك. نوبات كل شيء ما يحلها غير الرينال بايوبسي.
زين دكتور يعني هنا هو عنده 3+ to 4+، هاي مو تعتبر سيفير؟
لا دا اقول لك لازم نجمع 24 اور.
تمام شكرا دكتور.
اوكي